All right, everybody, here's how you fix your low back pain. This is the simple way that you fix it. If this doesn't work after you've tried it 3 times, you're gonna have to come and see me because there is another technique, because there's 2 ways that this works. But this is the first way, okay? Your most back pain originates not in your back, but in your hips and your pelvis. Your pelvis comes around like this. Like this, it's like a ring, and then you have a sacrum in the back. So it kind of sits like that, and then you have the other ring to your pelvis, and it moves a little bit like this. Not a lot of motion, but a little motion, and enough to cause excruciating pain, especially in weight bearing. This is the last, your pelvis is the last weight bearing joint on your body before you hit your spine. Most people treat spine pain like it's the real problem, when the real problem is coming from your hips and your pelvis. So what we're gonna do today is, when you look at your pelvis, these ASIS is what it's called, the anterior superior iliac spine, should be directly across from each other. They shouldn't be up or down. That's just not how it's supposed to be. It's supposed to be directly across from each other. Most people who have back pain are going to have one hip higher than the other one, and it doesn't really matter which one's higher for the sake of what we're doing in this video. So if you notice that your hips have one hip is higher than the other, and you have significant pain in your low back, even pain that is going down your legs, you're gonna get yourself a broomstick like this one. This is a 1 1/4 inch dowel rod for in the furniture making department of one of the major big box hardware stores. So what you're gonna do with this is you're gonna find a nice big flat surface like this, and you're gonna lay down on that surface and bring your legs up like this. Now your hips have to be at a 90-degree angle for this to work, okay? 90 degrees, just like that. And you're gonna take this stick and you're gonna put it on top of your left leg and underneath your right leg. And the way that you're gonna remember that is that most people have their watch and their wedding ring on top of their left hand and left finger, left wrist and left finger. So what you're gonna do is you're gonna put this underneath your right leg and on top of your left leg. Make sure your hips are past 90 degrees. This would be a 90-degree angle. You want them just a little bit past that. And what you're gonna do is you're gonna hold the stick with your hands. You hold the stick here. You're gonna push down with your right leg and pull up with your left leg, applying equal force. Equal force. You're gonna push just like this. You're gonna hold 1, 2, 3. It does not have to be excessive force. Act like you're trying to break this stick for firewood. 1, 2, 3. That's all you do, just to count to 3. Just 1, 2, 3. And after that, you stand up, and your back pain should be significantly better. If your back pain is not significantly better and still hurts very badly, then you probably have a sacral torsion. And to take care of a sacral torsion, it becomes a 2-part problem instead of a 1-part problem. So you will need a doorstop like this. A doorstop. My dogs have chewed this one, so it's a little weird, but this is the doorstop. You're gonna take that doorstop and you're gonna place it directly on your hip, just in back of this. It has to be facing that kind of same angle that your hip is, because that is how your sacrum looks. I'll put a picture of it up here. That is how your sacrum looks when you're doing that. So you're gonna put this, you're gonna lay back down in that same position like we were before, and then you're gonna put this on that same area on the left side. It's almost always on the left side unless you are a left-handed ditch digger who hurt yourself digging ditches. You keep your legs up like this, and then you just gently turn onto that doorstop like that, just 2 or 3 times. It's going to hurt very badly because that is actually correcting the sacral torsion. You pull that piece back out, and after that, you again apply the same rules with the stick trick. Same thing with the stick trick that you did before. You lay down and you put the stick on top of your left leg and underneath your right leg because of your watch and your wedding band on most people. Then you're going to, again, pull up, apply equal pressure down, equal pressure up. Like you mean business, but don't hurt yourself. Just gonna go up like that, just like that, just like that. And that should heal just about 85 to 90% of all back pain. If you have any questions, I'm always available to answer them. Let me know in the comments.